you've had a number of negative experiences and also unwanted, in a way, experiences with your diagnosis of MDS, and a number of problems related to the treatment that you had for MDS before being diagnosed with AML.
Yes.
And I wanted to see if you could give us a brief sort of background description of your adventure, if you want. You may call it negative adventure till the time you were diagnosed with AML.
Okay. long story, trying to make it short. So I was diagnosed with MDS in October 2016. And why I had the biopsy then was because in June of 2016, a routine physical noted low counts. So my PCP thought I had, I was anemic, and but wanted more testing. And I kind of blew her off and say, ignored her phone calls. And I finally complied and made an appointment with a hematologist at a cancer center or cancer clinic in Berkeley. And it found 13% excess blasts, evolving, I forget the term, but evolving to acute myeloid leukemia. Now, he wanted to check in a month, so it'll be about Thanksgiving in November, to see what the counts were. He wasn't going to do anything. And here it is the lesson of going to a so-called center of excellence versus your local hematologist. And if I had listened to him, I don't think I would have, ended up somewhere else. So I got a second opinion. I called another tip for leukemia patients. I called the Leukemia Lymphoma Society, and a nurse answered. And her first question was, "What's your blast count?" And then I told her, and she says, in very firm voice, "Get a second opinion. There are 3 centers of excellence in my area." And so I ended up at Stanford, and Stanford says I start chemo next week. And he talked to me about a transplant and a prognosis right off the bat. So again, going back to that first hematologist, he was willing to wait a month and then considered giving shots to stimulate this. I don't know what kind of shots, but injections to stimulate the production of cells. So here again, just the lesson of going to a place like Stanford. My 6 months of a week a month of azacitidine chemotherapy and a couple of biopsies. And then by the month of May, I deemed all set to have a bone marrow transplant. This was on May 25th, 2017. My brother was a partial donor, but he was my donor. I think he was 7 out of 10. I just remember that figure. And I lived in isolation for 100 days, and then started to recover. Declared to be in remission in August 20-something, with a biopsy and no sign of blasts. Okay. So things were kind of looking up, and I exercised and strengthened for a few months. In December, I had a nagging cough that I just wrote off as a reflex cough. My doctor detected it, and we just let it go. In January, that cough became more frequent, and this was January 2018. So a mere 7 months after transplant. And my appointments at Stanford's chest clinic showed nothing problematic, okay? And in April of 2018, I was diagnosed with viral pneumonia, starting out with a common cold virus that any of you could take on. But what they found was my GVHD in my lungs caused adenovirus to morph into viral pneumonia. So then I spent 1 week in induced coma with an intubator. And of course, I didn't know anything about this, and spent 60 days in the hospital trying to recover from that. And main thing was permanently damaged lungs, and receiving at first caregivers 24/7 for about 3 months. They came to the house, and I slowly strengthened. You know, for most of those 60 days in the hospital, I was tube fed, and my body essentially atrophied. I probably was junior high, grade 8 weight. I mean, it was pathetic. And I slowly came back with the help of physical therapists who taught me how to sit, stand, and walk again. And so 2018, the rest of 2018, and all of 2019, which is pre-COVID, I strengthened to a point where I didn't need oxygen with the cannula. Spent some money on portable concentrators. And now I use oxygen only when I sleep. So that really precedes the AML diagnosis. And I began thinking life is not going to be all that long for me. I mean, it's because my lungs will always be vulnerable to something. But nothing's imminent that way. But by that time, with my Stanford hematologist, I was getting visits, appointments with him every 4 or 5 months. Okay, it used to be every other month, but now it's 4 or 5 months. So in January of 2020, my accounts were robust. And in fact, just prior to that, he and I were thinking, and he's as much said, I don't think you'll have to worry about MDS again, because the relapses are common right after transplant or within 2 years. But here we're talking, I'm approaching 3 years. So we're feeling pretty good. And I felt pretty good throughout the spring of 2020. Okay. The week of my 3rd anniversary of transplant, I had a blood test 5 months after the January tests. And my platelets crashed from like close to 200,000 to 84,000. And I think, and reds and whites dropped also, but the platelets really crashed. And I'm paying, anyway, we'll get to the current situation, and then a biopsy on June 11th, 2020, showed a blast count of 43%. Okay. In the MDS diagnosis and the AML diagnosis, I essentially had no symptoms. It just comes out of nowhere. I guess that's the word. That's why they use the word blasts for how it explodes in you. And so that's what and I'm now in my 15th cycle of azacitidine chemotherapy, 1 week a month, coupled with I only know it as venetoclax.
Venetoclax, yeah.
Yeah. So venetoclax started last August. So the first 2 rounds of chemo with AML reduced the blast count from 43 to 38%, a meager drop. In late August, I started the venetoclax, nonstop, every day, no rest. Okay, 200 milligrams. December 2nd, my blast count of 2020, my blast count shows less than 5%. All right. I don't know if that's an aberration because this spring and the current situation, yeah, my counts are not rebounding as well as we like. So I'm under frequent watch and on the spot transfusions, you know, when if need be. And since July, another biopsy, we did not on July 1. So a third biopsy with AML, 1, 2, 3, 4, fourth biopsy showed a blast count of 15%. So it's creeping back in. It crept back in at a time when we slacked off on the venetoclax this past spring, just to give my system a rest. Okay, that's how it crept in. And so I didn't have a transfusion from end of September 2020 to July this summer. That's a long time without a transfusion. I was doing pretty well. Now, as I say, the game has started.